The first position you need to know is what you call the fowler's position. So please write it in the comment section. Fowler's position. Today I'm going to learn about the fowler's position. Just write it down. Fowler's. Fowler''. Fowler's position. Fowler's position. Why do you need to learn about the fowler's position? Fowler's position involves various degrees of elevation of the head of the bed. So the fowler's position is just, a broad term. And we're going to get in and learn various types of, positions. So when we talk about fowler's, it's a broad term. Okay. Now, what are the types of fowler's positions we need to master? What are the types? Number one, we have the low fowler's position. Low fowler's. So low fowler's, the head of the bed is elevated at 15 to 30 degrees. So please write it in your book. And maybe you can also write it in the comment section as well. Low fowler, 15 to 30 degrees. Now, why do we use this position for clients? It promotes sleep and relaxation by providing comfort for the client. Why should you learn about the low fowler position? It promotes sleep and relaxation by providing comfort. It helps with patients who may need minimal elevation, such as those with mild respiratory or digestive issues. Okay, so this is the low fowler position. So the low fowler is 15 to 30 degrees, and it promotes sleep and relaxation by providing comfort. What's the next one? After the low fowler, we go to the semi-fowler position. The semi-fowler position. With the semi-fowler, so please, before we get into the semi-fowler, I want to know, what is the level of degree for the low fowler? Is it 0 degrees? Is it 1 degree? Is it 2 degrees? Is it 3? Is it 0, 1, 2? What is the level? What is the level? Just type for me. Just type for me. I want to know. It looks like somebody got it right. 15 to 30 degrees. Okay, that is the low fowler. Now let's go to the semi-fowler. In the semi-fowler position, the head is elevated at 30 to 45 degrees. 30 to 45 degrees. And why do we do the semi-fowler position? It is beneficial for patients with respiratory complications, such as those who have difficulty breathing, and you also want to encourage lung expansion. Okay, it provides comfort for patients who are recovering from surgery. So we've learned the low fowler, we are learning the semi-fowler. Okay, so I need you to type in low fowler, what is the degree? Semi-fowler, what is the degree? I really want to know. Low fowler, semi-fowler. Now let's go to the next one. We go to the standard fowler position. Standard fowler position. Now, the standard fowler, the head moves to 45 to 60 degrees. 45 to 60 degrees, okay? And it is commonly used to relax the abdominal muscles. And it relieves pressure of the abdomen. And it aids digestion and respiration. So standard fowler, please write it down, 45 to 60 degrees. Standard fowler, 45 to 60 degrees. Okay, next position. High fowler. So the high fowler, notice that the patient is almost sitting upright, and that is from 60 to 90 degrees. The patient is sitting from 60 to 90 degrees. That is the high fowler position, 60 to 90 degrees. All right, 60 to 90 degrees. So we started with the low fowler. We've come all the way to high fowler. What other position do I want us to learn about? We have the lateral position, which is when the client is lying on their side. Okay, the client is lying on their side. So we have the left lateral, because you can lie on your left or you can lie on your right. So we have the left lateral position and we have the right lateral position. The left lateral side position, the client lies on the side, and the left side is the part which touches the bed. And on the right lateral position, it is the right side of the body which touches the bed. When do we use the left lateral position? It is for maternal fetal distress and during seizures. Two things: maternal fetal distress and during seizures. Maternal fetal distress, and when the patient is also having a seizure. That is when you put the client on the left lateral position. It's also used for liver biopsy when the client is positioned on the right side afterward to reduce bleeding. So, right lateral position is for um, is for is for liver biopsy. Left lateral position is for when you want to reduce maternal fetal distress. What about the lithotomy position? Lithotomy. So lithotomy position, just look at the way the client has been positioned. The client will lie flat on their back and their knees are flexed and their legs are in stirrups. Okay? So it's just like that. It's like a swan neck, right? And it's used for pelvic examination and for childbirth. So please notice that one too. Pelvic examination and for childbirth. If you have a client who stays in this for a very long time, it can lead to blood clot formation. So you want to make sure that you don't keep the client in this lithotomy position for so long. So please remember, lithotomy, if you want to do any pelvic exam or pelvic, procedures, and especially in clients who need to deliver a baby, lithotomy. Okay, now let's go on to the next one. Is the prone position. Many people sleep in this position, right? Prone position. Here, the clients will lie on their stomach and their head will be turned to one side. It is used for clients with spina bifida. Spina bifida. So please, what I need you to do is every position, write what it is used for. So semi-fowler, what will they do? Low fowler, lithotomy. What do we use for? What do we use it for? And then prone position. There are some clients you need to avoid the prone position in. There are some clients that you need to avoid the prone position in. So you need to avoid it in clients with abdominal incisions because they are going to lie on the abdomen anyway. So you want to avoid it in patients who have just had an abdominal incision, patients who have difficulty breathing, and patients who are unconscious. Because can you imagine if the client is unconscious and then you put him this way, maybe the client may vomit and then will aspirate the vomitus, right? So you want to be very careful with this particular position in people who have had an abdominal incision, people who have difficulty breathing, and people who are unconscious. Prone position. Prone position.